Hello and welcome to this special edition of Trust Talks, where we'll be discussing the Trust's new 5-year strategy to set out our bold and collaborative vision for delivering outstanding care, supporting staff and building stronger communities. We're joined today by a number of guests who helped to shape this strategy, so let's meet our panel.
Hi, I'm Mark Kelsey, I'm GP and Chief Medical Officer for Physical Health in the Trust.
Hi, I'm Anastasia Lungumlenga and I'm the Head of Community Engagement and Experience here at the Trust.
Hello, I'm Andy Scorer. I'm a member of the public. I also give support to my wife, which is also known as being a carer. I use services myself and I participate in various groups in the Trust on a voluntary basis.
Hi everyone, my name's Sarah Reid. I'm a staff governor and I sit on the Council of Governors at the Trust. I'm also a communications manager.
Hello, my name's John Pritchard and I'm Associate Director of Population and Health Equity here at the Trust.
Hello, I'm Rachel Mahia. I'm the Director of Quality and Professions. I'm a community nurse by background.
I'm Anne Cato. I'm a community champion for Hampshire and Isle of Wight Healthcare NHS Trust. I'm also a member of Health Watch Strategic Group in Southampton. And most of all, I'm a volunteer at St. Denis Activity Group, which is a mental health drop-in.
So before we dive into the specifics around our new trust strategy, what exactly is a corporate strategy and why should I care about it? Why should anyone within the trust organisation care about it?
For me, I think it's a really important plan for how we're going to meet the priorities and needs of everybody who uses our services. Because we must remember that within this region, we've got about 2 million people that would be using our services, whether it's learning disabilities, mental health, community services, 2 million people. And this document is what sets out our commitment to our population, to our communities, and to our staff as well, regarding how we're going to meet their needs and their priorities over the next 5 years.
Well, I think it does. It sets that direction, doesn't it? And for me, I think it's really important that many of the changes we need to make are things that are going to take quite a long time to do. So actually it helps us keep that focus on where we're going over the longer term while also addressing the things that we need to do now. So it sets that long-term direction for us.
Not only is this document about us and setting our direction for the next 5 years, but it's also been developed by us as members of this wider population and this community. Because from the very beginning, we went out and listened to thousands of people who told us what their priorities and needs were. And then, so it wasn't a case of somebody in the NHS who sat down and wrote this document. It was actually on the back of voices and feedback that we got from our patients, our service users and families and carers. And to me, that really elevates this document because it's not just NHS voices in here, it's also the voices of the people that use our services.
I think building on that, we estimate that we reach into somewhere between 2 and 3% of the households across Hampshire and Isle of Wight as an employer. So that's a huge proportion of our communities that are working for us or working with us. And they're also our service users in the communities that we're working in. So it kind of brings all of that together when you look at the aims of the strategy.
And I think for me as a member of public, your objectives, your vision for this strategy is about people. It's about patients, it's about carers, it's about services that you provide. So it really matters to the members of public because it's about us, what you are going to do in the future.
So Mark, what is the strategy?
So the strategy sets out our 4 aims as a trust, which are firstly to improve population health outcomes. Our second aim is to deliver outstanding care across the whole trust. Our third aim is to improve our staff experience. And our fourth aim is to deliver value for money. So that's sometimes described as our quadruple aim. So it's the 4 aims that will, I think, drive, as Andy said earlier, everything that we do.
I think it also gives, you asked why is it important, why should we care about it? I think it's important because it's our this trust is serving the people of the population, and like Anastasia said, we've got them involved in making those key decisions about what we should prioritise. And I think the interest from the public or staff is about what's our direction of travel, what's our priorities, where do we need to put the most efforts to support. And I think it probably helps give assurance to the public and staff that we've got a plan. And it's a big, huge trust. We're covering, 13,000 staff now. We need a plan, and this will give us that first step on the road to that plan, really, won't it?
What's also important to acknowledge is that we've had a really significant change in terms of a number of organisations coming together, and the premise of that was around removing barriers, integrating services, and us really looking at how we deliver to our population very differently. There's some great things in terms of growth and change and integration that are going to make quite a significant difference for our population. And as you said, our population is our staff. Often, we are patients in the area of where we work, but all the other people as well. What's from, this is from children to adults, and the variety of services that we deliver is so significant. It does allow us, it kind of gives us that anchor of or platform of where we start from.
When we look at the first aim around the population health outcomes, it's really well evident that health services will only ever address 20% of somebody's healthcare outcomes. So 80% of somebody's healthcare outcomes are down to things like employment, to housing, to social stressors, to their feeling of connectedness in communities, to their support networks. As a traditional health service, we would only ever be able to address 20% of somebody's healthcare outcomes. So it's hugely important we work with people like St Denny's, with other community groups right across the area, and other complementary partners within that wider system to help us address some of those needs, and to improve that population health. Because without it, those are the people that will then be seeking support from our services, potentially a bit later than we would like, and living in poorer health for more years. And that's what we're ultimately trying to address with that aim.
Yes. I think the other things that are really key in here as well are about what we're delivering and what will be the difference for the population. So it is about we've talked about delivering outstanding care. There should be an aim, and we continue to want to constantly improve the quality of what we do. You can't ever stand still. It's always looking at how can we do this better, how can we involve people so that we're actually making it what matters to you, and what matters to us as patients. But I think in delivering outstanding care, we're also going to improve the health outcomes. So that's one of the aims, isn't it? And I think one of the big things that we heard from people when we were doing our events where we originally met was about making sure it's close to home and that it's relevant for the population. And you described something where our population is so different. So there might be some differences in what we deliver in different areas, but the standard should remain the same and what's available should remain the same.
Yeah, and that touches on one aspect that I know appeals to me. It's not stated in these words, but you could say the desire to nip problems in the bud before they get started, which is, if you like, tend to be used words like prevention and things like that. But that's what it amounts to, isn't it?
Exactly.
And to do that, you need to work with the people who are in contact with them and the groups who are in contact to understand what and how to do that. Yeah. Because, the NHS in one sense can't do everything, but they can be involved in a lot and support lots of things being done.
So aim 2 is about delivering outstanding care and looking at it for majority of our people and our communities, it'd be like, your NHS, aren't you supposed to be delivering outstanding care anyway? So what are the changes that we can expect to see over the next 5 years that will really give us the confidence that yes, we are delivering outstanding care? And what's the change that we can expect to see?
I think embedding the continuous improvement is really important because, it goes without saying that actually we all come to work as clinicians and all of our staff because we want to deliver outstanding care and deliver a good job. But unfortunately, sometimes in a massive organisation and in difficult situations, complex situations, that can be really difficult. So sometimes things do go wrong, and the important thing is that we recognise that when things go wrong, we learn from that and we learn how to improve and to make things better so that those don't happen again. So I think for me that's kind of what's at the core of it. I think the other bit around kind of person-centred integrated care for me is moving away from where we've had traditionally kind of silos of care where you might have a physiotherapy team in one place and a nursing team in another place, or a GP surgery, all looking after the same patients, for example, but not necessarily working together. And what we want to try and change is that those teams work really well together and that they feel like they're part of the same team. They're working and getting the best out of each of the member of that team to deliver the best for the patient. And I think the words there around person-centred integrated care is what that means. It's about how we reorganise ourselves to actually work better around the patient and not have patients falling in those gaps between services, which is what often happens. It's not repeating yourself. It's not having multiple visits from different people all kind of doing the same things during a day, or people that are sick and not understanding what other people are involved in as a patient. Actually it's really important that as one trust, as one NHS, we know what each other's doing within our services, and we know what we're doing for that patient, for you as the patient.
The way I see it is also the organisation stopping to ask the service user, the carers, because they are quick to tell you when there has been a change. So just to remember that you involve the service users, the carers, and everybody, but don't forget them while you are making continuous improvement to stop and say, has it made any difference to you?
The big bit for me is really just thinking about we've always had services that the patient needs to fit into, and this strategy aims to fit around the patient rather than the other way. So actually what you're describing is you don't go and just, you might have multiple issues that may fit in various services. The idea is that we manage and support somebody holistically. But I think your point, Anne, as well, about the fact that it's so important that we not only hear the patient's voice, but the carers, and we have that triangle of care, making sure that we're listening, because long gone are the days that I remember from 30 years back in my training, where actually, we were delivering services to a person. We were telling people how it was. Now it's about what do you want, and that's really important change, very different perspective. And that's going to be a thread throughout this strategy of involvement and ongoing working together and hearing the voice of people, all of us who are patients, but families and so on, understanding how we can do it better.
And the joined up care aspect that's mentioned under the second aim of delivering outstanding care is actually quite important to this, because in one sense, who's it joined up with? And actually, although, there's lots of bits of the NHS that aren't part of this large NHS trust.
Yes.
There's the, acute hospitals, and GPs, most of the GP surgeries, as just very simple examples of other parts of the NHS and yet, just because someone's got one particular issue that is delivered by our trust doesn't mean they haven't got at least some other issue that may need to be dealt with by someone else.
I think what you're describing, Andy, it's kind of talked about in the integrated neighbourhood models bit of the strategy as well. So the integrated neighbourhood models is one of our transformation areas which is really what I described before around, and you're describing, of how we actually work better together around the patient and work together within the trust, so that our services within the trust are joined up, but also how we work with our GP practices that are looking after the same patients, and the acute hospital that's looking after the same patients, and then anyone else who's involved. So community voluntary sector groups are all really important to kind of wrap around the patient in that way, and that's what the integrated neighbourhood models means.
That makes sense, doesn't that? To be able to have all those people aligned together to recognise the importance of what they bring to that service, don't they? And for the person within that centre of that to be able to say, well, actually, it might not necessarily be an NHS service. It might be that I need to go to social prescribing and maybe go and visit Anne's lovely activity group that will help them, to be socially communicating with each other and having better mental health just from being involved in neighbourhoods and partnerships and stuff. I think when in relation to staff experience, I think staff across the trust experience the trust in very different ways, don't they? For a start, there'll be people that come to work just literally because they've got a local job that fits in with their health, their family. So offering them flexible working from that point of view is really useful to enable our staff to work with us, but also still care for the people that they look after at home. So it's having that support for flexible working, and having the support for supporting some of our staff who indeed are carers themselves. So it's important to offer support. They're only human themselves, and to offer that support. To offer them opportunities to develop, I think, is really important. And we've got under this improving staff experience around effective staff development, to give them the platforms and the skills to develop careers and to feel valued and wanting, to be invested in, to ensure that they stay with us. It's much easier to grow your own staff in that respect, isn't it, than to have to continuously recruit in for short-time posts and then coming out. So I think there's a challenge there to the trust to enable us to continuously develop our staff. We have our staff survey every year, so we can tell. That's a really good indication if staff fill that in. It's a good indication for us about drilling down into teams and services that are doing really well. And it's also an opportunity for us to learn where things are going well, but also where things need to be improved on. So at the Council of Governors, we will look at that staff survey results and we will see, in certain areas we're doing really well, like listening, so our Speak Up service is really good. But in other areas, maybe around training or stand-man training, we're sort of not delivering so well on. So it gives us an indication also about how staff are feeling. I think it would be good to hear from Rachel as well, because obviously she's in charge of a whole division.
So I think across every division we've now got a really clear programme of work that is around our people, which I think is, as you've described, all about development, about looking to make sure that the culture and the approach around being able to speak out and raise their voice and listen to staff is really important. What I hear a lot from staff is around having a job that's doable. And that's a real challenge, isn't it? Because, we all acknowledge that demand in NHS services is increasing and money is reducing. And so the breaking point actually sits with our staff. And what we want to do is look after them, because without them, they're not going to be able to deliver this strategy for our patients. So I think, there's a lot of work in every division. We work hard on looking at how we can do that. There's work around capacity and demand modelling, which essentially is looking at the numbers of staff we have in order to deliver the number of activities or the skill set that's required for different services. To make sure, as John, you've already mentioned about quality improvement and being more efficient in the way that we do things. That's the way of us managing this when there isn't extra money in the system to be able to do so. So I think as Sarah mentioned about staff surveys, we actually do them every other month internally within our divisions to get a temperature check, so that we hear from staff about what are the problems. Tell us. You know, it's like patient feedback is equally valuable. You know, we feedback from anybody helps us grow and helps us realise where we're just not getting it quite right.
And it does need to be continuous, doesn't it? Like, I think actually the staff survey annually is really helpful, but actually we need our staff to feel connected into their management, their leadership teams, and to know who to go to, so that they can raise things or bring things up if things aren't going well.
And I think in addition to getting staff to be comfortable with raising issues and having that culture of speaking up, I think a key and important thing that we've been hearing through, especially over the last year in terms of the feedback we've been getting, is management also showing a seriousness towards taking actions when things have been raised. And this is particularly key, especially when it comes to reporting discrimination, for example. And we know that certain groups within within the trust have more experiences and example with regards to discrimination. And many of them telling us that, you know what, I'm not going to report it because I feel that it might not be taken seriously. But what I like in the strategy is that there is a line in the strategy that actually says we will not, the exact wording is our people will recognize that there is no tolerance of discrimination of any kind. And I think that's really important. So embedding that within our services and within our teams will definitely help to achieve that level of culture and so on that we're talking about, and giving people, all members of our staff, the confidence to speak up.
As we bring the round table to a close, what are you looking forward to most from the strategy?
I think for me it's about that connection with community organisations, community groups, connections with the communities. I think that's where all of this starts. I think that's where all of this becomes embedded. So yeah, I'm really looking forward to that work and then see all that preventative work that comes off the back of that.
I think for me, what really excites me about this strategy is that whole piece of work and conversation we've had around addressing health inequalities. Because I think it's sad that in 2025, we're still talking about, and the evidence is showing us the vast differences with regards to the different ways that different communities are impacted, whether it's people with disabilities, whether it's people from ethnic minority communities. And so seeing that put down here, that is going to be one of our main aims and our main focuses, really excite me, because hopefully in 5 years' time, Catherine will invite me to another round table like this, where we can really drill down and look at the data to say, this is the impact that we've had, this is the change that we've had. Because looking at it on paper, it's words. But when we start adding numbers and hearing the stories that people are going to have over the next 5 years, it's actually people's lives that are going to be impacted. And so I really look forward to making that difference to people's lives and experiences when they use our services.
The thing I'm most excited about, which kind of builds on that, I think, and it's a different perspective, I suppose, as a GP, is the thing I'm most excited about is the neighbourhood working. Because as a GP, we see people with all sorts of problems, physical health, mental health, social problems. We see the effects of poverty, drugs, alcohol, all of those, kind of that whole range of things. But actually, I recognise with my medical training that I'm often not the best person to see them and deal with their problems. So for me, the neighbourhood health and the integrated neighbourhood models is really important, because it helps us bring all of those people who have got the expertise to deal with that patient's problems in around the practice and around the team working together and around the patient. And in the past, things have felt very siloed. So actually, people just working in their own area and not thinking about the wider health service and health system and what the patient really needs. So that's the bit that really excites me. It's a real opportunity for us to change how we work and deliver things for our patients, deliver what they need.
For me, very quickly, the patient care risk equality framework, I'm excited because that is got evidence, and from what we were talking about within developing of the strategy is where there is evidence, you act upon it. PCREFT, Patient Care Risk Equality Framework, has got so much evidence that sometimes I just want to cry when the carers, no, I do, when the carers come, they are 80, some of them 85, and they are still caring, and they are not even being involved in the care. And, that is really exciting. That is really exciting, and I look forward to seeing the change.
My hope for this strategy is that we can bring it to life and embed it in everything we do and enable our staff to get on board and own it. And to ensure that where we've got success, that we celebrate it, and that we keep a continuous eye on those aims and objectives and ensure that everything we do fits into one of those 4 things. So it keeps us focused as a trust. But I think in order to make this different from any other strategy, we need to embed it with our staff, bring it to life, get them involved in it, but get our partners and our communities and our patients and carers involved as well. But the beauty of this is that it gives us that sort of blueprint and permission for our staff to do something a little bit different. Most of them are probably ready for it, I would think, and then some of them are already doing it. So it's just endorsing what they're doing and ensuring that we're able to support them in that endeavour.